Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the July 10th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County has added 33 new COVID-19 cases since my report yesterday. As of Friday, July 10th at 1 p.m., Dubuque County has 862 positive COVID-19 cases. No additional deaths were reported, so a total of 22 deaths remain in Dubuque County. About 6% of the just over 14,000 people tested in Dubuque County have been positive. 4 individuals are currently hospitalized, and about 49% of Dubuque County positive cases have recovered to date. The state added 520 cases since yesterday. As of July 10th, 2020 at 1 p.m., Iowa has a total of 33,762 positive cases. In all, about 1 in 9 Iowans, or over 360,000 people, have been tested, and about 9% of Iowans tested have been positive. Deaths reported in the state total 742 Iowans. 87% of Iowa COVID-19 deaths are in those over 60 years old. Currently, 169 cases are hospitalized, and finally, about 76% of Iowans have recovered. Dubuque is not alone in this dramatic increase in cases. Both Iowa and the nation are seeing significant jumps. Yesterday, the CDC reported over 59,000 new cases in one day. Over 132,000 deaths are reported in the U.S., with almost 800 new deaths yesterday. The national and Iowa epi curves are increasing, and although deaths are still on the downward decline, as this community spread continues, we will eventually affect the elderly and those with underlying health risks. And as people with already fragile immune systems catch the virus, this adds to the burden on our healthcare providers and hospitals to provide care. So you're getting public health measure fatigue. Tired of my repeated messaging about physical and social distancing, wearing masks and hand washing? This COVID-19 data continues to be the reason for all of us to maintain physical distance by staying a minimum of 6 feet from others when you're out in the community, whether it be at a store, a restaurant, or wherever. The data doesn't lie. It also shows that our community is not clear on what it means to quarantine and/or isolate. Like most contagious diseases, you don't have to be sick or have symptoms to pass it on to others. We know that's the case with COVID-19, especially since many positive cases experience mild symptoms they may not even notice. So let's go over this. Quarantine is what you do when you're exposed to someone who's tested positive or who has symptoms of COVID-19. In other words, quarantine is used to keep someone who might have been exposed to COVID-19 away from others. Quarantine helps prevent the spread of disease that can occur before a person knows they are sick, or if they are infected with the virus without feeling symptoms. People in quarantine should stay home, separate themselves from others, and monitor their health, along with seeking medical assistance if symptoms are not manageable. For COVID-19, exposed people have to quarantine for 14 days. Isolation, on the other hand, is used to separate people infected from the virus from people who are not infected. Those who are sick or test positive with COVID-19, including those with no symptoms. COVID-19 requires a minimum of 10 days of isolation. People who are in isolation should stay home until it's safe for them to be around others. In the home, anyone sick or infected should separate themselves from others by staying in a specific sick room or area and using a separate bathroom if it's available. So how long should you isolate or quarantine? Let me show you. If you have close contact with someone on day 1, you have to wait 14 days before you're free to go about your normal daily life. So you count from the day after through 14, and then this day you're out of quarantine. Here's another very common situation. You have an exposure or close contact with a positive or symptomatic case, and you start your 14-day quarantine. And then somewhere during the quarantine, you develop symptoms of COVID-19. You get a cough, shortness of breath, a fever, headache, any one of those symptoms. At that point, the day you started the symptoms, you start isolating because you're now sick and assumed to have COVID-19, which requires 10 days of isolation. So you count 10 days from the onset of symptoms, and after that, after this 10 days, you're done with isolation. In order to complete the isolation, you have to be fever-free for 72 hours, symptoms improved, and 10 days passed since symptoms started or the person tested positive. So this would be the minimum amount, assuming all three of those things happened. So let's do another one. Let's say you start your quarantine after you've been exposed to a positive case on day 1. And then someone you live with or you had contact with develops symptoms and or tests positive. You then have to start your 14-day quarantine period over from this last day you had contact with that person after they tested positive or were symptomatic. So you also have to separate yourself from that person within the home. So you start right here, and if you wouldn't have been exposed to that person, you'd be done here. But since you were, you have to add on to complete that 14-day period, and you'd be good to go right here. Now, what if you cannot avoid contact with that person in your household? Maybe it's a child and their elderly parent, or you have a small home, etc. You have to wait until the end of their 10-day isolation period to begin your 14-day quarantine. So their 10-day isolation period, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, you would start here for your 14-day isolation period, which would be over here. That's a really long time. So you can see how the isolation or quarantine periods may change depending on if symptoms develop or you have an additional contact with a positive case. Remember, isolate for 10 days if you test positive for COVID-19 or have symptoms. Quarantine for 14 days from the last direct contact or exposure to a positive or symptomatic case. So yesterday I reviewed testing and whether you should be tested. If you've had a known exposure to a positive or symptomatic case, testing would be warranted, but not absolutely necessary based on what I just told you. Keep in mind, regardless of the test outcome, whether it's positive or negative, you must quarantine for 14 days. You cannot test your way out of quarantine. But sometimes it's helpful to know in order to protect others around you, whether you're positive or negative. Positive or negative tests also help public health people like me know what's going on in the community and are able to provide better surveillance. So where should you get tested? If you are symptomatic and have a known exposure, it's best to call your doctor or healthcare provider, and they can evaluate whether or not you need testing and may also want to evaluate your symptoms in person or over telehealth to provide any treatment or guidance. This is especially important if you have an underlying health condition that puts you at greater risk for severe illness from COVID-19, such as lung or respiratory issues, diabetes, obesity, immune suppression, or if you are a smoker. Your doctor will make a judgment call if you should be tested by them or their clinic. If you are simply a contact or exposed to a positive or symptomatic person, the Test Iowa Clinic may be the way to go for you. All you have to do is do the assessment at testiowa.gov and show your code and Iowa ID at the Test Iowa Clinic site at Epic Health and Wellness, 1075 Cedar Cross Road. Or you can go to any Test Iowa site in Iowa. The Test Iowa Clinic in Dubuque will be open next week, Monday through Thursday from 5 a.m. to 9 a.m. and until further notice. This Saturday, tomorrow, Crescent Community Health Center at 1689 Elm Street, that's next to the Eagle Country Market, will host the Test Iowa Clinic from 6 a.m. to 10 a.m. Please remember to register through testiowa.gov before heading to that clinic site. So as we continue to take extra measures to avoid large gatherings and groups, maybe it's time to go back to some virtual socializing. After today, you're all experts in isolation and quarantine, so see if you can share the information. Maybe do a virtual or driveway COVID-19 trivia. Thanks for tuning in today. Let's all be safe and practice proper public health measures. When in doubt, don't go out, and remember, we continue to all be in this together.